Right here. Welcome, everyone. Thank you so much for joining us this afternoon for Nutrition for Fertility with registered dietitian Judy Simon. We're so thrilled that you could all make it today. We'll be talking about the key nutrition principles and providing practical advice to optimize conception using nutrition. Our host today is Judy Simon. She's a registered dietitian at the Roosevelt Clinic and adjunct faculty at the Nutritional Sciences program at the University of Washington. She specializes in reproductive nutrition and has been recognized as a fellow of the Academy of Nutrition and Dietetics. She's also a national leader in fertility and nutrition. We thank you so much for taking the time to host this seminar today. And without any further ado, we'll turn things over to you. Thank you, Judy.
Thanks, Diana, so much for inviting me back to speak at the Whole You. And you're right, nutrition for fertility is definitely my passion. I've been just privileged to work at the U for over 20 years. And that's where I really had the opportunity to work with so many amazing faculty in our women's health and our university reproductive care and learn more about fertility. So I'm hoping to, in the short time we have together, talk both about male and female fertility, talk about diet patterns, talk about environmental exposures, and how can we optimize our health so that those people who choose to build families can do it in a healthy way, in an easy way, and as natural as possible. And I want to start off, I just want to tell you just briefly about my story. And I know that several years ago, I was struggling with infertility, and I had this plan that by age 30, I was going to be a parent. And I had my husband on board with that. And you know what? Age 30 came and go, and 5-6 years came and go. And I really, it was a really difficult time for me personally to figure out why, as a healthy young person, I was having so much trouble to conceive. This was before the internet. I didn't have a community, and it was a really lonely place. And so I think that's really what started my initial interest into fertility. I'm happy to say that I have 2 adult children, and feeling so full of my heart that I do have them. But I think so often when folks are young, we're taught back even in high school, our sex education curriculum is usually how not to get pregnant, how not to contract a sexually transmitted disease, but we don't really learn about fertility and if we want to have that option in our lives. So fertility is really the capacity to produce a child. And not everyone knows. A lot of people just think, well, hey, when I decide to get pregnant, I'm going to stop birth control, or I'm going to try, and it's going to be really easy. So the likelihood of conception is highest those first few months of unprotected intercourse, and then it actually declines. So about 80% of couples will conceive in the first 6 months of attempting pregnancy. But by age 40, things change, and it's decreased by half. So if you compare to women in their 20s and 30s. So the impact of age is much more pronounced with women. And women are in the workforce, we're going to graduate school, and a lot of women are delaying pregnancy, fertility, and sort of surprised when they're late 30s, early 40s to find out, well, they're struggling. So what about men? With men, it's really doesn't decline until about age 50, perhaps quality and quantity of sperm if they're healthy. Women do have more options now. There are options like egg freezing, but that is not the focus of my talk today, but we do have more reproductive options than we've had. So infertility is defined by the Academy of Reproductive Medicine is the failure to achieve pregnancy after a year of trying regular unprotected intercourse. For those women who are older, that are over 35, it's recommended that after 6 months without conception, that these women would go ahead and do a little bit of looking into what their fertility potential is with an OBGYN or a fertility doctor or other primary care provider. And I will say, if either partner, if this is two partners planning to start the family, have any health issues, it's probably better to look into optimizing their health sooner than later and maybe not waiting a year or even 6 months. So a few facts about infertility is that about 15% of couples globally are infertile. About half of infertility seems to be related to female factor issues. About 20%, the male factor is the primary issue. And it's probably male factor infertility contributes to 30 to 40% of all cases of fertility. And I think this is important to mention because quite often it's a woman who maybe she has PCOS, she's not ovulating, so she's putting all the focus on her health. Meanwhile, it's important to check into her partner's health too. So some of the common causes of infertility, the most common is ovulation disorder. When a woman isn't regularly ovulating, she is going to have more challenges with conceiving. And you may have heard of PCOS, polycystic ovarian syndrome, which we can easily do a whole talk on, is probably the number one reason a woman even shows up in a fertility clinic. Semen abnormality, whether it's quantity or quality of sperm, tubal defects in the women. There's a whole group of unexplained women who have the inflammation of endometriosis, and then there's kind of another group of other medical issues. And infertility, I think it's important to realize it really presents its own challenge. If you find out after a year that you're struggling, you've waited a year, that can cause a lot of emotional stress. It can cause physical stress, people feeling really depleted. They're changing their lives over trying to get pregnant. It can be really difficult. It can be a financial burden, depending what workups are covered or not covered by their insurance and what funds they have, and then access. Not everybody has access to healthcare that can help them. And I know that I can remember up in clinic, we having farm workers from Yakima, Eastern Washington, coming to clinic with literally large paper bags of money of their community, helping them to bear the burden up for costs they didn't have for fertility treatments. So stepping back a little bit, I'm mostly going to be focusing on diet and nutrition today, but I really think all couples or individuals who are planning to become pregnant really take a big step back and look at their health. What are they eating every day? Are they nourishing themselves optimally? Are they getting enough sleep? Are they, do they have strategies to manage their stress? Is smoking an issue? How often are they drinking? Are they using recreational drugs that can have an impact on sperm and even on female health too? How is their health in general? Have you had a physical the last few years? And then what environmental exposures do you have? And I'm going to talk about the ones that are a little bit more food related, because those can have a negative effect on fertility. So when we talk about where can nutrition make a difference in improving fertility outcomes, it's absolutely essential for women who have polycystic ovarian syndrome. The majority of these women have some degree of insulin resistance, and lifestyle management and nutrition is really important. So I encourage anyone who has PCOS or thinks they have that diagnosis to work with their provider and potentially get an individualized consultation with a registered dietitian. Women who have been diagnosed with endometriosis, hypothalamic amenorrhea basically means that these are women who are not having their regular menstrual cycle because of a lack of available energy. Maybe they're a really elite extreme athlete and they're not able to, either by choice or just by circumstances, are not providing their bodies with enough available energy, so their hormones shut down and don't work. So they're not cycling and they're going to have challenges getting pregnant. Men or women with prediabetes and insulin resistance, this adds a lot of inflammation to their body, along with type 2 diabetes, that can make it more challenging to get pregnant and have a more challenging pregnancy. Women may find out that they have diminished ovarian reserve, especially that's the number of eggs available in their ovary, especially if they're older, but it can happen with younger women. women who have had repeat pregnancy losses can benefit from improved nutrition, women with current or past eating disorders. And we have found that at fertility clinics, we have a higher rate of patients coming to fertility clinics that have eating disorders because of the potential disruption to their endocrinology. Weight concerns, if people have had some recent changes, COVID's been hard on a lot of people, a lot more fat storage with less activity or changes in diet, that excess visceral fat can have increased inflammation. And then male factor issues, which can be diagnosed with a semen analysis. Okay, so I'm going to give you a little bit of the research, and I was pretty excited when the fertility diet book came out in 2008, because that's when I actually opened a part-time private practice, really focusing on reproductive nutrition. And I remember people saying to me, well, what the heck does nutrition have anything to do with fertility? Well, my colleague and friend, Jorge Chavarro, who is an amazing epidemiologist and doctor at Harvard, had looked at data from the Nurses' Health Study. And the Nurses' Health Study is still going on, but this particular component of the study looked at a subgroup of over 17,000 women who were trying to conceive. And so in the Nurses' Health Study, every 2 years, they complete these very extensive surveys. So you find out what they're eating, if they got pregnant, all about their lifestyles. So what they found from this cohort, from this group, that they found that there were about 10 different factors that these women with the ovulatory disorders, and probably most of them had PCOS, that if they had at least 5 of these habits, some of these were avoiding things, some of these were adding things in, they could actually improve their fertility by 69%. So this is like the first epidemiological studies where we really found things like avoiding trans fatty acids, which were found in fast foods and some processed foods, cooking more with monounsaturated fats like olive oil, avocado oil, getting more of our protein instead of just from animals, but relying more on beans and vegetable sources, more whole grains. This was an interesting one that came out of this study, having a full fat dairy product once a day, taking a prenatal or multivitamin that contained folic acid and B vitamins, getting their iron more from plant sources and supplements versus red meat, drinking water in place of sugar sweetened beverages. And for the women that lost small amounts of weight, they saw their menstrual cycles becoming more regular, and then 30 minutes of exercise. So this was pretty interesting information that finally was showing us, well, what are those studies? What are we seeing in the literature? And since then, there's been many couple studies, there's been many surveys internationally looking at Danish diet, Nordic diet, different diets. And what the theme that was coming out of these studies was look at different diet patterns that we were seeing, that more plant-based, more fruits and vegetables, less meat, more fruits, more beans, were showing shorter time to conception. Well, a large study that was done at a few different sites called the Earth Study, which was also done with some of the same Harvard folks and then some other institutions. They followed couples that were going through IVF in vitro. And the reason this was interesting is over the last 20, 30 years, fertility options have really increased. And so the technology has just improved so much. So it's given a lot of folks options to have a baby that were suffering from infertility. So this means that when you're going through IVF, eggs are extracted from the woman and they're fertilized with the sperm outside of the body, and then they're transferred back in. So these couples were going through IVF, and the Earth Study wanted to find out, well, why wasn't IVF 100%? Why was it 50 or 60% successful for a live birth? So they wanted to find out, let's look at diet and let's look at environment. And so they got extensive information on what type of food these people were eating. And then based on their food patterns, they broke them up into 4 different patterns, sort of a pro-fertility diet, more of a Mediterranean, kind of that whole food plant-based diet, the original fertility diet back in 2008, and then another healthy eating index. And so what was really interesting is they followed these women all the way to live birth, and not many studies do that. Not just did they get pregnant. And so what they found out was that eating fruits and vegetables with less pesticide residue was more predictive of a full-term birth, more whole grains, fish, dairy, and soy. And I bring up soy because there were initially some studies where people were concerned that soy was a weak phytoestrogen and it might have a negative effect on fertility. And actually, since then, several studies have shown quite the opposite. And this study even showed that the folks that consume more soy seem to have less of some of the endocrine disruptors in their body. So another positive benefit. They found that having fish rather than other sources of animal protein, providing omega-3s, was beneficial. Folks taking 800 to 1,000 micrograms of folic acid in a supplement. And if they had supplemented their vitamin D, if they had a low vitamin D, and if they had supplemented their B12, if they had a B12 deficiency, we saw higher rates of success. So I mentioned these dietary patterns, and there's been studies, and you might wonder, well, what do they mean? What's the foods in those diets? So I want to make sure we're not being too Eurocentric, but these are the studies that have been published. But you can see with the Mediterranean plan, much more plant-based, eating fish and meat and eggs and potatoes and wine in moderation, and less sweets and processed foods. Whereas when you look at the Nordic, they use different oils. Instead of olive oil, they have more canola or rapeseed oil. And they were really much less processed or refined foods. And I'm looking at the Okinawan plan, you could see red meat and dairy was less. So looking at these more plant-based pans, we're seeing less inflammatory diets. So what do Americans eat? So when we look at the dietary guidelines that came out most recently, we can see when we look at the age groups of 19 to 59, our healthy eating index score is only 56 out of 100, meaning we could be doing better. And really what we're finding is if you look at these blue bars, that shows you where could we be making improvements in dietary patterns. So it's showing you that the average American does not eat enough fruits, vegetables, beans, starches, grains, or fruits. Now, if you look at the purple, we eat enough grains, but not a large enough percentage of them are whole grains. So this is kind of concerning. And then if you look at fish and seafood, we're falling short too. So if you look at what changes have been going on over the last, half a decade, actually meat consumption had been going up. So is dairy. The only thing going really down was the milk. So it wasn't like we're getting more plant-based between 1950 and 2000. Now, maybe after 2000, it's improving a little bit. We don't have all that data. So what the research is sort of pointing to is we keep seeing this role of inflammation. And so what is inflammation? It's basically a process in our bodies, our response. How do we respond to injury or infection? Okay, so it's a normal response. But what we're finding, and science is finding, that if there's a prolonged subchronic inflammation going on in our bodies, that can have an adverse effect on fertility. It can disrupt our menstrual cycles. It can impact implantation. It can worsen endometriosis, and it could even possibly impact recurrent miscarriages. So we're finding inflammation with normal pathways for ovulatory activity are blocked or impaired, and that there's a negative impact on sperm quality. And in fact, I don't have the numbers in front of me, but the amount of sperm is actually going down. So we think about guys having millions of sperm. We just need one to get pregnant. But the numbers are actually decreasing. So this is sort of a busy slide, and it came from a recently published journal article that was really looking at inflammation and its impact on fertility. So if you look at the more anti-inflammatory, the blue part of the slide, on the left part of the slide, you're going to see that those people that are getting those polyphenols and carotenoids, all those important nutrients that are in fruits and vegetables and plant-based foods, plus they're getting omega-3s and healthy fatty acids, that actually what that's doing in our body is reducing stress. It's reducing inflammation that goes on the body. And you can see even increased intake of soluble fiber and helping the gut. So what is this doing? It's actually reducing inflammation. That's improving fertility, and that term ART means assisted reproductive technology. So if a couple or a singleton is going through intrauterine insemination, or they're going through IVF, it's improving their success rates. It's improving clinical pregnancy and live birth rates, and it's improving embryo quality and yield. So let me give you an example in real life. So I've been working with couples, and more often women, and they will come to me and maybe they've had a failed IVF cycle. And they're like, oh my gosh, we're going to transfer another embryo. What are some of the things I can do, where we're doing another retrieval? And just working on improving in their diet over 2 to 3 months, we've seen better outcomes. Same thing with repeat pregnancy loss. So the idea is, if we work on having a more anti-inflammatory type of a diet and lifestyle up front, maybe these folks won't have to go to the fertility clinic, and we'll have higher rates of natural birth. And then if you look on the right side of the slide, you can see increased inflammation. So what are the foods that are contributing to that? More saturated fat. Think of the fat on a piece of beef or in salami. Refined carbohydrates, more simple sugars, more processed meats. And then when we look at these diet patterns, those folks who have a higher glycemic load, that means there's less fiber in their diet, there's more simple carbs, there's more insulin resistance, they're consuming more energy-dense foods that are perhaps adding, visceral fat. They're not getting all those nice, vitamins, minerals, fiber, all those polyphenols, all those that help contribute to being antioxidants in their diet. And so they're upregulating genes involved in pro-inflammation pathways. So they're increasing inflammation. So that makes fertility more difficult. It reduces the success of IVF and IUI, and it reduces semen quality. Okay, so the good news, and I think this is exciting, and this is a thing that I've been learning over the last 20 years because we have more data, and frankly, I'm seeing it with my patients. When they make small changes, and so I might work with someone who doesn't eat fruits and vegetables at all, and they start to add 1 or 2 a day of something that they might like, whether it's apples in season, or it's grapes, or it's frozen blueberries, more vegetables, more whole grains, legumes, nuts, and fish. And you all might be reading this and thinking, well, gosh, isn't that healthy just for general health? It absolutely is. So a couple of the key micronutrients that I wanted to pick out and mention is, you've probably heard about folate. And I mentioned in the Earth study, they found that actually 0.8 to 1.0 grams, it should be actually grams of folic acid, or is helpful with not only fertility, but preventing neural tube defects in pregnancy. So we know that when there isn't adequate folate, because really what folate does is it helps with rapidly increasing cells. I mean, with adequate folate, we will have decreased infertility. SAB is spontaneous losses, increases in treatment success. So where do we get folate? It's so easy to get. It's in our leafy greens, it's in our beans, it's in our lentils, it's in citrus, it's in avocado. And in this country, we fortify our flour. So our flour actually has folate added to it. Okay, another vitamin that research has come out on over the last maybe 10 years is understanding about vitamin D. And I think it's so important living in the Northwest. We know that we don't get a lot of sunny days, and right now, very few of us are getting much natural D from the sun. And there are actually vitamin D receptors expressed in the ovary, in the endometrium, and in the placenta. And subfertile women, this is a really interesting study, who were undergoing IVF had 4 times the rate of success if they had sufficient vitamin D versus those who were deficient. And I remember hearing some research presented at American Society of Reproductive Medicine from Yale, and they actually found because vitamin D, we get it from our sunshine, it has a reaction on our skin. It's in very few foods. It's added to dairy. There's a little bit in mushroom, a little bit in fish. That it's a fat-soluble vitamin. It's stored in our fat. So we're finding that folks that have more fat in their body are often more vitamin D deficient. So they found in this Yale study that they actually wanted a woman to have higher vitamin D levels closer to actually their BMI, and they found more success in IVF outcomes, which is really interesting. So while vitamin D deficiency, not having enough, and that's a simple blood test you can get with your provider, might adversely impact fertility, in the absence of deficiency, it doesn't appear to play an important role in human fertility. So I think it's like, stay tuned. We're doing more research on that. So really quickly, I want to talk about some of the macronutrients. We were talking about macros. You don't have to count them, but carbohydrates, and poor carbohydrates get bashed a lot. And I think if you went on social media, you might see on a fertility site, they might tell you, oh, don't eat gluten and don't eat carbs, and carbs are horrible for you. And it's really quite the opposite. Carbohydrates are our energy source, or a preferred energy source. And we want you to really emphasize, we have good evidence that those that are higher in fiber, so I'm looking at in the picture, looking at oats, looking at whole grains, actually have amazing benefits. And we have the data that they actually increase fertility. Eating whole grains increase fertility. So if somebody has celiac disease and they have to avoid gluten, there are many grains they can eat. They can eat millet, they can eat buckwheat, they can have quinoa, so there's no problem. Carbohydrates are rich in fiber and minerals. There was some concern that if you ate way too much fiber, would you reduce your estrogen levels, impacting infertility? And that's really not a concern. We want people, and I'm going to talk about fiber in a minute, to have more fiber in their diet. So good sources of B vitamins, iron, and actually when they're whole grain, they really help with insulin resistance versus more the simple carbs. So let's talk briefly about fat. We know that fat is important for the diet. It makes food taste good. It helps us to absorb our fat-soluble vitamins, but it does help with egg, the oocyte maturity and quality. It's necessary for ovulation and for embryo implantation. We need fat, and I'll show you in a few slides later that we need it for sperm too. It's important substrates. And so on the right, you can see, well, what would be some fats that would be beneficial? So fats from fish, from avocado, from seeds, from nuts, from olive oil, from avocado oil, canola, sesame oil. Those will all be healthy oils with good monounsaturated fats to help with fertility. So when it comes to protein, I think it's important to know that we can get adequate protein from plants, and of course we can get it from animal products too. People had been worried about soy, and as I mentioned a little earlier, that actually soy is a weak phytoestrogen, and it doesn't have a negative impact on fertility. In fact, it's a really healthy food for those folks who have polycystic ovarian syndrome. It really helps to improve a lot of metabolic parameters. Okay, so we do have evidence that adding fish twice a week can help with shorter time to conception, and that plant protein increases the benefits of fiber, vitamins, and minerals. And just really quickly, here's fiber. The dietary guidelines, our recommendations are really to eat 25 to 35 grams of fiber. Most Americans don't even get half of that a day. It contributes to our healthy gut biome. Fiber is the prebiotic, or the food for your good bacteria. It enhances our immune system. And our gut biome impacts the endocrine system. It helps us to get rid of excessive estrogen. So really, regular digestion is something I ask all my patients about. So really quickly, I think I've mentioned the pro-inflammatory foods that we want to try to reduce. I'm not saying never have them. A French fry tastes good, but a lot of people are putting them in their air fryers now and crisping them up on their own in a healthier way. so that we want to have, red meat and processed meats less often, less sugar. You be in charge of the sugar rather than, buying something so sugar sweetened. Less of the very processed foods, refined carbs, saturated fats, and trans fats. And just examples of, having regular soda, having some of the very processed frozen foods. But I don't want you to feel like all processed foods are bad foods, because there are a lot are very healthy. There are a lot of frozen foods or prepared foods that are really just the same as if you or I made them. And I'm a big believer in people having food that is convenient to eat. Not everybody has the skills and the time and the money. Okay, briefly on supplements for women, I just want to mention that we do have the data, and you've seen from some of the studies, that taking a complete prenatal, ideally 3 months before conception, having that folic acid, having iodine, and I'm happy to share more if anybody wants to know some specifics. Send me an email. Vitamin D is often in a prenatal, and I think it's great to know your vitamin D level when you are trying to conceive. If a woman has PCOS, we have good data on inositols, berberine, and vitamin D. I think it's a good discussion to have with your provider. Omega-3s, if you're not eating fish, can be affordable and a good supplement. If you're a strict vegan, you should be taking a B12 supplement. And choline, you do get some choline. It's in our egg yolk, so a vegan may not be eating that. They'll get some from vegetables. It's a little trickier to get enough as a vegan. Choline works with folates to help develop the nervous system of the forming fetus. But to just take an overall expensive fertility antioxidant, we are really lacking the data. And I'll talk about that in the males in just a minute. But I want you to check with your provider about your individual supplement needs and make sure supplements you're taking are third-party tested. Over the last few weeks, women have bringing in the most expensive prenatal supplements I've ever seen. We're talking $60 to $70 a month, and that's absolutely outlandish. So please don't think more expensive is better. When we look, I want to switch over to the male side. And when we look at male nutrition studies, they've also been looking at diet patterns and definitely seen impact on sperm quality. But what they usually always lack is, well, did we get a live birth outcome? Okay, and that's the data that we really need. So a couple studies have found similar results with diet impacting time to conception and live birth. So lots of studies looking at sperm, and I'm just going to mention one here, where they were looking at men attending a fertility clinic, and they compared their diets to 4 different diet patterns: the healthy eating index, the alternative index, Mediterranean, to the DASH diet. And really what they did find from this, and if you like data, I've got some up here for you, is that if they ate more plant-based, no matter which of the indexes it was, they saw better sperm quality. So that's good. That's a good thing, especially that can make the difference in any single cycle of fertility. But we have the same impact of oxidative stress, inflammation, can cause sperm DNA damage. So eating more foods from the right and left on the left can potentially make a difference. And what happens is it's literally structural damage that is happening to the DNA. And I want to show you this cute little sperm. And what I learned from, I was honored to be at a conference in Boston this past fall called, I think it was called Soil to Fork for Fertility. And I was with a lot of researchers, and Suni Mumford, who's now at Penn State, she presented research on sperm. Let me borrow this cute sperm slide. And basically what I learned is that really the entire cell is really in the nucleus of the sperm. So sperm are really sensitive to oxidative stress, and that's where the DNA, where it's all happening. The rest of sperm is kind of the powerhouse and the functional part of the sperm. So definitely a lot of damage can happen. And my favorite study was a Fertility study. It was a 14-week randomized controlled trial where they let men eat whatever they wanted to eat, but half the group ate 60 grams of nuts, a handful of nuts on top of what they were regularly eating. and they saw an increase in total sperm count, a decrease in sperm DNA fragmentation, and an increase in a function in sexual desire, which is a good thing. So despite low quality evidence of supplements for males, they're frequently recommended, and some of them are very expensive. They're seen as a way to counteract this detrimental effect of oxidative stress on sperm quality, but a Cochrane review, and that's a review that looks at all the studies, really found that they may improve a couple's chance of live birth, but really the studies were of low quality. 2 more studies were done since the Cochrane review, and neither one, and these were really well-designed studies, found that male antioxidant supplements were helpful. So what we're finding with male conclusions is that male diet does influence fertility, a checkbox for fish, seafood, fruits, veggies, whole grains, nuts, and legumes, and a reduction in meat, sugar-sweetened beverages, and that we have high quality evidence on semen quality, but we don't have as much on clinical outcomes. So remember, food is a common source of environmental exposures, and that diet can have some modification on some of these adverse exposures. Really quickly, I just want to mention this because this is some really new data that my colleague, Dr. Audrey Gaskins, who's now at, did her studies at Harvard, but she's now at Emory, that outdoor air quality, and we all can't do this, but if you live in a major roadwork area, keeping your windows closed during rush hour, using HEPA-type filters, we're seeing lower rates of fertility in areas where people are really exposed to a lot of outdoor air quality. And we're seeing this especially in places like China. Indoor air quality, if you can, use exhaust fans when cooking. Don't let anyone smoke in your house. Limit use of indoor fireplaces with wood, candles, and air fresheners. And vacuum and dust. Get rid of your dust. Have people wipe or take off their shoes when they come in your house. BPA, you may see that on the bottom of your water bottle. We're finding that infertile women have higher measures of BPA levels than fertile women. So in order to reduce your exposure to BPA, there's a few things that you can do. When you're cooking, try to buy food that comes in glass jars, frozen or fresh, and use less cans because the lining of cans has BPA. More things are coming in Tetra boxes and glass jars, or cook your beans fresh if you can. Avoid cooking your foods in plastic containers, such as microwaving. Use glass and ceramic because the plastic BPA can come into your food. Don't reuse water bottles that are meant to be disposable, and try to avoid cooking with nonstick pans. So phthalates are the chemicals, and exposure to them from your personal care products and your cleaning products can decrease fertility and alter sperm and testosterone levels. And the easiest way is to look at your products and avoid things with perfumes, and you avoid things with scents. And that takes a little bit of time, but the great thing is the half-life is short. So if you're really trying to get pregnant and you start changing out your products, that can make a difference. So in summary, I know I went through things pretty quickly. I hope you learned that a plant-forward diet doesn't mean you have to be a vegetarian. Just doing some of those swaps can help improve fertility and meet the needs for a healthy pregnancy. Women should take a prenatal at least 3 months before they're trying to conceive. Try to consume 2 to 3 low mercury seafood meals a week. If you can't do this, consider omega-3. Prioritize eating fruits and vegetables. In a perfect world, I'd love to see you eating 5 to 8 a day. Start right at breakfast, include them in your snack. I had a patient tell me yesterday that she moved all the condiments out of her refrigerator drawer, and she filled them up with healthy snacks like cut up fruits and veggies and stuff, so that when she opens the refrigerator, she's grabbing those. Incorporate more whole grains into your diet. Try to do a little swap on your protein. Swap out maybe your meat and chicken for beans, lentils, soy, and fish at least a few times a week. Limit your intake of fast food and ultra-processed foods. Come up with your own healthy snacks. You can roast chickpeas and edamame and make a great salty, crunchy snack. Have popcorn. Optimize your management of chronic health conditions. If you have PCOS, diabetes, elevated lipids, hypertension, any autoimmune disease, work with your provider to be as healthy as possible, especially if some of the autoimmune disorders that can have a lot of inflammation. I didn't get too much into things like coffee. Boy, it's really, there's so many studies that show no impact. And I would say, with the review of the literature that I've done, I would say 1 to 2 cups per day is fine. I know that I was trying to get pregnant, I drank decaf coffee first half of my cycle, and then when I knew, I wasn't pregnant, I would switch back. Same thing with wine, but I would really, really encourage you to try to cut back. I do want to mention, with my passion, I'm so lucky at the University of Washington. I get to work with patients every day, optimizing their reproductive health. I also have my own practice with the same emphasis. And over the last couple of years, something that I've always wanted to do, I'm working with a fertility doctor. We are writing a book, and in fact, our manuscript is due, like we're talking, in 5 days. So stay tuned. April of 2024, we are going to have the best, most affordable paperback book that you can have that talks about lifestyle. We talk about sleep and stress and so many helpful things along with food in a very positive way to help give you some guidance and idea. So I'm really excited about that. And I think if I stop talking, I can actually take some questions and see if you have any questions. And I appreciate you letting me do kind of a quick zip through.
Right. Thank you so much, Judy. That was so informative. Wow. Lots of wonderful information shared. I will let folks noodle on some questions. We did get a few questions early on in the chat that I think I'd love for us to address. And then, if anyone has any additional questions, please raise your hand at any point and I'll feel free to call on you to ask. But earlier on in the question, in our seminar, we had a question around the Nordic diet. Does the Nordic diet low-fat dairy mean modern low-fat milk, like goat milk?
That's a good question. I am not as clear. I do know that, like, for example, like when you get Siggy Skyr yogurt, that they actually take non-fat yogurt, non-fat milk, and then they add cream to it. So I think it is more low fat. And I would say of the studies that did Nordic diet pattern per se, we're not nearly as many that looked at the more Mediterranean. So I think what we're finding is when it comes to like inflammation and all, milk is sort of neutral, okay? Because we found that 1 full fat dairy a day can actually help women with ovulatory disorders. And it is a good source of protein. I think where people get really confused is a lot of people just like switch to almond milk or something because they go, oh, it's a plant milk, it must be better. And a lot of the plant milks are mostly water. So for example, almond milk, there's not, depending what's in it, it could have sugar in it, is usually mostly water and vitamins. So really look in and see, whereas unsweetened soy milk or a pea protein will give someone more protein. So a lot of the folks who have insulin resistance do better if they balance their protein and carbs together. So I get worried when they just do almond milk and cereal, not a lot of protein there. You can bring in plant protein or some animal protein, but that's a good question.
Fascinating. Wow, thank you. More on the topic of diets. Rahel asked, how long does it take for the body to come back to normalcy after implementing these food habits?
Oh, okay. So if you had a more inflammatory diet and you're making changes, I think that the changes like start happening immediately. Like, for example, if you start to add 2 vegetables and a fruit to your diet when you were eating potato chips and you swap that out, you are going to immediately be adding more fiber to your diet, which is going to help with a healthier gut biome. So you can have immediate responses. And that's what I love, because often I see patients like 3 to 4 weeks later, and they're like, I feel so much better. I'm going to the bathroom regularly. I'm not as tired. So, every little step you take is helpful. And I think that that's really, really important.
Fascinating. Thank you.
Oh, I see one question. I'm going to jump in. Somebody asked about the book. It starts with an egg. I really feel that there are a lot of people recommending a lot of supplements, and I agree. These supplements can cost you a couple $100s. And so I think that's why I don't want to make too many general recommendations. I think it's really important to talk about your provider, whether, that's such a good question. And we're learning more. And some of those supplements that are recommended in some of the books aren't even safe when you're pregnant. So like, for example, we don't have safety data. So I think that's something to really refer. In our book, we give the background on them, but we're very specific about when it might be right and talking to your provider. We really lean on food first, and then some of those supplements as needed, like the folic acid and things like that too. That's a good question.
Fantastic. Since you had mentioned folic acid, the next question we got was, what is the difference between folate and folic acid?
Okay, so, folic acid is the form that we get in the supplement, and the folate is from the food, right? And so I think where there gets to be a lot of confusion is just how we measure it. And I really think the most important thing is, at the end of the day, that getting as much as we can from our food is the most important thing, and having that we have enough data that we know that with at least 400 micrograms of folic acid, we have seen the reduction in neural tube defects, okay? But that is one nutrient. I would say both B12 and folic acid, when I was at this fertility conference, are really hot topics that we need to know more. So I think it's kind of like a stay tuned. Make sure you're getting it in your supplement, and make sure you're getting enough in your diet would be important. Somebody asked about iodine. Let me jump in on that one. Thoughts on iodine, right? You have to be careful because a lot of sea salt is usually not iodized. You can find some that is. And we do want you to have some iodine in your diet, unless maybe you have Graves' disease or certain thyroid conditions, because iodine is essential for thyroid functioning, and the thyroid really runs your reproductive hormones. So in the prenatals now, we want to see at least 150 micrograms of iodine, because not only does it help for your thyroid function, but for the growing fetus. So we do know that mental health and brain development needs adequate iodine. So you will get iodine naturally from fish, from seaweed. The problem is we don't always know how much is in the soil in our fruits and vegetables. So if you are trying to conceive and you're using sea salt, you might want to mix some iodized in there, and make sure you're getting it in your supplements. It's a good question.
Fantastic. Another question back to folic acid at the top. Is 5 milligrams of folic acid still recommended for those with diabetes?
I have not seen that recommendation. The only really high recommendation I've seen, and I would check with a maternal fetal medicine expert, is sometimes if a woman has actually had a baby with a neural tube defect, they will have to take 4,000, but I've not seen that diabetes recommendation. I would not take more than 1,000 without talking to your provider to make sure that's safe. There may be some specific situations for more, okay? There was a good question on CoQ10. So our bodies make CoQ10, and what we're trying to do is we don't want those eggs to age, and our eggs keep aging. So there's some data that CoQ10 can be helpful for male infertility issues. I know a lot of people recommend CoQ10. It's an expensive supplement to buy as a good, it's a good product. And as far as its help, it is an antioxidant, so it could have some benefit, but really for female fertility, the data is not that strong. So I might recommend it for someone, a good quality product, if they're going through an IVF and this is their last chance. They're older, they want to have everything on their side. Do I think everyone needs to take it? I don't think we have the data to support it. Would it hurt you? Probably not. You might kind of make it, but we don't have pregnancy safety data for it. So I do tell women when they're pregnant or they do an IVF transfer that they should stop taking the CoQ10. Some doctors recommend it to everyone, but there is not a lot of data on it, to be really honest. It's amazing what makes it out. What makes it out? Oh, lead. I don't know what I can say about lead. Yeah, there's a question here about, lead contaminating our soil. I just talked about chocolate the other day on the media about lead and cadmium in our yummy cocoa. Yet we don't really know. And I think overall right now, what we do know is the benefits of health from plant foods far outweigh, heavy metal. I mean, I have a concern about the frenzy of people eating bone broth. I don't know, people feel like it's this really amazing health food um, that doesn't really have much data. And I'm actually concerned about heavy metals that can leach out of bones that have been cooked for many hours. So you can't just say that we can eat food totally free, because a lot of these metals, like even like mercury, is ubiquitous. So that's why we recommend that women eat fish that has less mercury. And we do even give guidelines into how much. So we're not saying eat fish every single day. We're saying 3 times a week. Oh, I do like the question about meat alternatives, about Beyond Meat or Impossible Burgers. I think for some people, those can be a stepping stones to eating a more plant-based diet. Like, it's really hard to eat less meat. I kind of feel like they're fairly processed and they use a lot of packaging and all. I would say I think you can get so many less processed, delicious veggie burgers made out of beans or quinoa or something like that. That might be a good stepping stone. So I think they're kind of expensive, but for some people that are plant-based, they could be a stepping stone. It's really good. I think I went over, Diana, so you tell me how I'm doing.
Oh, no, you're doing fine. We've actually got about 8 minutes left.
Oh, good,
Oh,
good.
yeah.
I wasn't sure on my timing. I looked at the time and started to rush, so I got a little bit worried.
No, you're
Okay.
fine.
I love the question about, should we be eating organic fruits and vegetables to make sure it has low pesticides? Helen, that's such a good question. I wish I had 100% answer. So the most important thing that we can do is eat the fruits and vegetables and wash them. The most important thing we can do. Even if you buy something that's certified organic, there are certain pesticides that organic farmers are allowed to use. Okay. So yes, I would love if we could all eat, local and low pesticides and things like that, but that's just not accessible for everyone. And I know a lot of people look at, and I used to too, look at the EWG, the Environmental Work Group, to see the Dirty Dozen and the Clean 15. But a lot of that has been disputed from scientists about what type of measures they're using. So I kind of don't recommend that anymore. I will tell people, if you're at the grocery store and you're looking to buy kale and the organic is 10 cents more and that works in your budget, go ahead and get it. If you're lucky enough like us to have like a lot of farmers markets year round, even for folks on SNAP and limited resources, we're giving double fresh bucks to encourage people to eat more fruits and vegetables, which is really important too. So I think it's more important than you eat them. Sure, if you can afford them and they're local, but I always wonder if your apple is coming from South America and it's organic versus something a little more local, you might have more nutrients, from the one that was more local. Oh, somebody asked about a good hemoglobin A1C. That's for people who maybe have prediabetes or diabetes. I think in the diabetes world, we do shoot for, if you can have a hemoglobin A1C under 6.5, but I think that's a really good discussion to have with your provider, if that's possible. When I have men and women in the pre-diabetes range, I tell them, in 3 to 6 months, you can usually lower your hemoglobin A1C with diet and with exercise. And I really didn't mention exercise. I can't believe I didn't mention movement, but it really goes together because it reduces stress. We have good data that people who exercise more regularly, actually, that's a help when it comes to fertility. So I just didn't fit it in there, but it really is important. I love this question. Why are we seeing women getting pregnant after the age of 50 years old? Well, I could tell you about the chances of that happening naturally are like 0.05 or something. So when you see people in the media, they probably were using a donor egg. Okay, so that means they carried the pregnancy, but it was another woman's egg, which was considerably younger. Maybe it was her partner, or maybe it was a donor sperm, but that's not going to happen with that. Good question. Is it comparable to make smoothies and juices with fruits, vegetables versus eating it solid? That's a great question. So when you eat the fruit solid, right, you've got all the fiber in it. I think it really depends how you make the smoothie. Like, I'm not a fan of, and I don't want to use a brand name, but you know those Vitamixes that totally pulverize the fruit and you like lose a lot of the fiber? I'm not such a fan of those because the more you kind of beat up the fruit, you do lose some of the vitamin C. You do have some oxidation. You're kind of stressing out the fruit. But if you're just throwing some smoothie, you're throwing some fruit in a blender along with some veggies and maybe from yogurt, that's still going to be great. Maybe you lose a little bit of, vitamin C, but not much. Um, but, it's still a great way to get it. Oh, sorry if I missed the answer. Was keto and I didn't even talk about keto and intermittent fasting on purpose because I wanted to get all the good stuff out. We really don't have any data on keto as far as fertility. I know that some people, and I'm not advising it, who have lost weight and reduced some body fat, that might have helped them to cycle and have a regular cycle. Intermittent fasting is such a big basket, but we really haven't seen it as a tool to help with fertility. I tell people that we all fast overnight. It's good to have like kind of a cutoff time at night when you're full and you're satisfied. That would, be a good time, but I don't think really the data supports it. And I feel like keto is sort of the anti of the plant-based diet. Do you know what I mean? It's really promoting higher fat and higher meat usually. So I'm still sticking more with the data and what I see with people every day doing better with more plant-based. Oh, somebody asked, why do you lose vitamin C? Well, think about this. If you took an orange and you blenderized it for like a couple of minutes, you're actually doing some oxidation and it will decrease the vitamin C by a little bit. So it's an oxidation process. Leftover versus cooking fresh. Oh, that's a good question. If you're cooking fresh and you're eating it within 4 to 5 days, you're probably having very little nutrient loss. You're actually saving a lot of time, right? And I find that my folks that do prepping, prepping on Sundays or Wednesdays are more likely to eat those fruits and vegetables rather than rotting in the drawer, right? Because they've actually incorporated it into a recipe. Okay, how am I doing on questions? Somebody wanted to know what whole grains were, and I think they got a good answer on that. That whole grains are the complete grain. They haven't been milled. So, right. So there's a difference between, sometimes you see whole wheat bread, and then you really want to look for 100% whole wheat bread so that you're getting all of the bran from the wheat where a lot of the nutrients lie. More fiber, more protein. Oh, are there any? Go ahead.
Oh, sorry. I think you were just reading the question that was just submitted. Are there any supplements that should be combined with others to absorb?
Oh, that's interesting. So when you're taking a fat soluble vitamin like vitamin D, it's going to be absorbed better if you actually take it closer to a meal that has some fat. So that's a really good one. I find that people sometimes struggle so much to remember to take the supplements they do. I often say, take it with a meal because that's going to be the easiest way to remember it. But, so often you think of a prenatal, they've kind of put them all together. So like we talk about, there's iron in a prenatal that a woman really doesn't need until her second trimester. But if you're drinking a big cup of coffee with your prenatal, the tannins in the coffee may reduce the iron a little bit. So it's a little tricky, but I would say in general, usually having it with a meal once or twice a day is going to be fine with absorption.
All right. Great. And, we are at the top of the hour, but there was another question that came up that, I think we'd like to share as well. How will your book be different from, it starts with the egg?
Oh, it's going to be completely different. Well, our book is actually, I'm so excited about it. We really go through the studies and we go through all the different food groups. We go through fruits, we go through vegetables, we go through legumes, and we really explain how they how they help with health at a much more in-depth level. It's about the eggs, and it's not just about one person's story. It's about research, and it's about talking about stories. I'm going to brag and say that in each one of the 17 chapters, there's an individual story of one of the patients that I've worked with, like her fertility journey. And sometimes it might do more with stress, or it might do more with starting to work out more, like a lot of the lifestyle changes. And we also have a recipe that goes along with each chapter that we've used in one of my cooking classes. So this is something tried and true. Oh, it's going to be a way different. And we really do a deep dive into the research, and we don't cherry pick it. We go through, because you've got a physician and a registered dietitian, and we've got a lot of medical experience, and we have other people reading it too. So we are really careful about the recommendations that we make. I so appreciate so many of you coming to this talk on a snowy day, right? And thank you. And please feel free to email me. My email's on there, jdsimon@uw.edu. If I can help you with any resources or people in the community, that would be great.
Yes, this was such an informative talk. I, for one, am very excited about your book, which I think
Thanks.
comes out in April. Is that right?
A year from April, I wish.
A year from April.
April
Okay.
of 2024. I can't even
Sorry.
say the title yet. We haven't finalized it, but when we do, boy, we'll promote it and let you guys all know. It'll be great. But we do have dietitians on staff here, several of us, that love to help with reproductive health, male and female. So we are here for you too as providers at UW.
Fantastic. Well, thank you so much for this informative seminar and all the wealth of information that you've shared. Yeah, we thank you all for attending. Again, we will be sending out the, of course, we'll be sending out the recording soon, and we look forward to connecting with you all another day.
Great.
Thank you.
Thanks, Diana.
Thank you so much.